In this session of the Pediatric Emergency Medicine Fellows Research Design course, we will discuss writing and submitting your manuscript for publication. We have completed all the steps in the research process. We have asked and refined an answerable research question, searched the medical literature, selected a study design, subjects, and variables, completed the sample size determination, have written and submitted a research protocol to the IRB, and possibly applied for grant funding. We have collected, managed, and analyzed the data and have presented the results as a poster or platform presentation at a national conference. Now it's time to complete the manuscript for submission. The goals of this session are to understand the peer review process, develop an approach for writing each section of the manuscript, and to understand the ethical and legal issues of publication. This session is divided into 3 sections: peer review process, writing your manuscript, and publication ethics. We will start with the peer review process. This is an overview of the peer review process. An author submits their manuscript to a journal. It is screened by an editorial assistant who makes an assessment. The manuscript can be sent to reviewers or rejected without review. The reviewers prepare comments and recommendations for the author to address. The author revises the manuscript, and if the revisions are accepted, the manuscript undergoes editorial board assessment. The editorial board can accept the manuscript and send it to the publisher, or reject the manuscript. This is a simplified version of the peer review process. Notice that the arrows are bidirectional, except after the manuscript is sent to the publisher. This can become a frustrating, iterative process. The goals of the peer review process are to review potential conflicts of interest, determine the validity of your study, determine if it is appropriate to the journal's target audience, and to improve the quality of the manuscript prior to publication. What are the editors looking for in a manuscript? Not surprisingly, what they are looking for can be described using the finer criteria. Is it feasible? Are the methods valid to address your research question? Is it interesting? Is the topic interesting to their readers? Does it fit the journal's focus? Is it novel? Does it embody a new idea or debunk an old one? And is it timely? For example, recent increase in invasive group A strep disease. Is it ethical? Is it IRB approved? And is it relevant? Does it have the potential to impact patient-oriented outcomes? Let's look at some of the roles that people play in the peer review process. The editorial assistant determines if there is conflicts of interest, duplicate publications, copyright issues, and non-compliance with instructions. The editor-in-chief does a brief review and assigns the manuscript to associate editors. The associate editors assess the quality of the manuscript and determine whether to send it to reviewers. There are typically 2 to 3 reviewers who may or may not be blinded to the authors and institutions. The reviewers are typically asked to review manuscripts in their area of expertise. They are asked to evaluate some version of the following criteria. Is the science sound? Is the topic relevant? Are there ethical issues involved? Is the writing clear and without errors? Are the tables and figures appropriate? The reviewers may also refer the manuscript for consultation, for example, to a statistician for comments on the appropriateness of the statistical approach. Reviewers are obligated to promptly review the manuscript, have sufficient expertise in the topic area, reveal their potential conflicts of interest, maintain confidentiality, provide an unbiased appraisal, and be familiar with the journal's policies. The associate editors assess the reviewer's comments and make a preliminary decision prior to the meeting of the editorial board. They may reject the manuscript, or they may accept the manuscript with or without revisions. Acceptance without revisions is rare. To put this in perspective, the Annals of Emergency Medicine has an approximately 20% ultimate acceptance rate for original manuscripts. Handle revision requests tactfully and follow all suggestions. Avoid sounding defensive. Create a point-by-point response for each request or question. Indicate where in the manuscript the changes were made. Editorial rejections can be made for several reasons. These include unsound science, unoriginal content, unintelligible writing, or an inappropriate subject for the journal. The peer review process has several weaknesses. There is no evidence that improves the quality of published manuscripts. Reviewers have poor to no training. There is poor inter-rater reliability among reviewers. There is a potential for bias, and the process favors positive results and can't detect fraudulent data. In selecting a journal, review recent issues to determine the focus of the journal and review the author's instructions for guidance on their target audience. Consider whether you want a subspecialty journal, such as Pediatric Emergency Care, or a general journal, such as Pediatrics or Annals of Emergency Medicine. Consult with those more experienced in the process. Determine which journals do your reference come from. The time frame may also affect your journal selection. If you have lots of time, submit high and can always resubmit to a moderate to lower journal. If you are short on time, submit to a moderate to low journal for a best shot at acceptance. Journals are rated on several factors: the number of articles published per year, how frequently their articles are cited per year, and how many times articles are cited in the year they are published. The most common factor is the impact factor, or the number of citations per article in the 2 years since they were published. There are also subspecialty impact factors. The impact factors of some of the top general medical journals are listed at the top of the table. For comparison, some of the specialty journals that we may consider for submission are listed in the table below. An impact factor of 10 is generally considered excellent for medical journals, but it is best to compare journals in similar areas. For example, Annals of Emergency Medicine has an impact factor of 6, while Academic Emergency Medicine has an impact factor of 5. Open access journals have become common. Open access implies that articles are free to access, so can reach a broader audience. There are a variety of open access models. Some of the traditional journals use a hybrid model and publish some articles for free and some articles that require payment. Publication in an open access journal is required for some publicly funded research. There is an article processing charge of several $1,000s for most but not all open access journals. One of the upsides of open access journals is that they are published sooner. Some have expressed concerns about the quality of articles in open access journals, though I could find no evidence that supports a lower quality of evidence, and there may be variability in their quality. We will now move on to preparing a manuscript. The Equator Network is a great source of reporting guidelines for most types of study designs. Many journals are requiring the completion and submission of these guidelines forms or checklists. The User's Guide to the Medical Literature is another excellent resource. It is helpful to review the criteria by which your article will be critically appraised before you write it. There are several additional valuable resources available to help in preparing and submitting your manuscript. These include the uniform requirements for manuscripts submitted to biomedical journal from the International Committee of Medical Journal Editors, the AMA Manual of Style, and publishing and presenting clinical research by Browner. Follow the journal's instructions for authors explicitly. We will use the Annals of Emergency Medicine instructions for authors as an example in this session. Scientific writing is clear and precise. Use simple, short sentences with an active voice. Avoid jargon and excessive abbreviations. Writing is an iterative process of feedback and revision. Feedback is essential before submission. With an active voice, the subject is doing the verb's action on the objects. For example, medication A resulted in a lower admission rate. With passive voice, the object is the result of verb's action by the subject. For example, the admission rate was lower with medication A. What is required by a journal differs from journal to journal. Most journals follow the International Committee of Medical Journal Editors recommendations, but have preferences that go beyond the general ICMJE structure. Annals of Emergency Medicine requires a cover letter, a manuscript submission agreement, each author's individual contributions, a title page, an abstract, a manuscript, and references. In addition, the manuscript requires IRB approval acknowledged in the methods section, registration of clinical trials, and a conflict of interest declaration for each author. The cover letter must include the title of the manuscript, the submission type. For example, Annals of Emergency Medicine uses 4 main categories with subdivisions. The 4 main categories are research, review or literature summary articles, commentary, or other. The cover letter also includes the corresponding author, a brief description of the study, prior publications and/or presentation, potential conflicts of interest, and copyright restraints. The title page for an Annals of Emergency Medicine submission includes the title of the manuscript, the authors and their affiliations or institutions, any prior presentations at conferences, any grant or other financial support, conflicts of interest, a data sharing statement, the word count excluding the abstract, and each author's contributions. The title of the manuscript should be a simple declarative sentence. State what you did and your conclusions. The PyCod format is helpful to highlight the major aspects of the research question, such as the subjects and setting, the dependent and independent variables, the controls and reference standards, the primary outcomes, and the study design. Here are two alternative titles: a randomized trial of D5 normal saline versus normal saline in the treatment of children with mild to moderate dehydration due to gastroenteritis. Or, the addition of dextrose to normal saline decreases the admission rate of children with mild to moderate dehydration due to gastroenteritis. In general, I find the top title to be the most common format, but prefer the bottom one that describes the results of the study. Both titles include elements of the PyCod question. Both include the patients and the intervention. The top title also includes the study design and control, but does not include the outcome. The bottom also includes the outcome, but does not include the control and the design. This is a structured abstract. It includes the title, introduction or background, methods, results, and conclusions. Think of it as the abridged version of your manuscript. We will review the components of each of these throughout this talk. This is the general structure for a manuscript. 1 page for the introduction, 2 to 3 pages for the methods, 2 to 3 pages for the results, and 1 to 2 pages for the discussion. Each of the major sections may require subheadings. For example, the enrollment criteria, outcomes, and statistical methods may be subheadings in the methods section. The presentation should follow a logical sequence for each of the goals and hypotheses. Goals should be linked to the methods that are linked to the results that are linked to the conclusions. The introduction sets up your research question and your hypothesis. In paragraph 1, include what is the problem and why is it relevant and important. In paragraph 2, what is known about the problem in the existing literature? What remains unknown? In paragraph 3, what is your study question, including the definitions of the population, settings, intervention, controls, outcomes, and study designs? And what is your study hypotheses? Your hypothesis is the anticipated answer to your research question. In pediatric patients with mild to moderate dehydration in the emergency department, does the addition of dextrose to intravenous crystalloid decrease the rate of admission? The hypothesis is, we hypothesize that pediatric patients with mild to moderate dehydration in the emergency department treated with the addition of dextrose to intravenous crystalloid will have a decreased rate of admission. The method section is a description of how you intend to answer your research question. It is organized to set up the results and the conclusions. The method should be clear and easy to reproduce and include the subject enrollment criteria and the setting, definitions of interventions and outcomes, extensive descriptions of new methods, measurement scales to be used and whether they are validated, the study design, a statement of IRB approval or waiver, and the statistical analysis plan. A complete analysis plan includes sample size determination, descriptive statistics, and inferential statistics. Sample size determination requires a definition of the clinically significant effect size and the desired levels of alpha error, beta error, and power for a randomized clinical